So this first part here just gives a little bit of narrative on the emergency order itself and some of the administrative justification for the emergency order. For folks interested in more of that, I would listen to the press conference that Acting Mayor Davison did last Wednesday when she announced this emergency order and had economists and other folks, doctors, some of the hospital CEOs there to help talk through some, from a public health perspective. Um, so first detail, most important detail, folks. Okay, so this emergency order begins on Tuesday, December 1st, 8 a.m., and it ends on January 1st, 8 a.m. Sections 1 and 2, which dealing with individuals and requirements for individuals likely to be contagious with COVID-19, remain.
How are you gonna watch that? Here, come here.
I'm gonna go ahead and mute folks, and it'd be helpful if y'all just muted yourselves. Thanks. So requirements for individuals likely to be contagious, and so this is pretty much the same language that we've seen in prior emergency orders. Basically, everyone in the municipality shall limit outings and physical contact with those outside of their household, and then just gives a series of different recommendations based on CDC guidance and others for individuals likely contagious. The heart of the matter starts with section 3 of here regarding gathering limitations. So the highlight is gathering limitations for indoors shall be no more than 6 people, and for outdoors limited to 10 people. There are a variety of different exceptions, which I'll go through. So first is drive-in events. Daycares and day camps are exempted from this gathering limitation, and actually there are a couple of attachments that deal with these, which I will go through here soon, that give a little bit more detail and specificity on some of the gathering limitations or some of the natural limitations in some cases for particularly daycares and day camps. Pre-K through 12 is at 50% classroom occupancy. So like I've described before, this isn't really going to have much of an impact in most classrooms, which have an occupancy of 40 or so. So most classrooms weren't imagined to have more than 15 or 16 students when ASD was considering opening schools. Wedding and funeral services without food or drink to 20 people. If you have food or drink, it's the same as the prior limitation, the overarching 6 indoors, 10 outdoors. Next is worship or political expression. That's set at 50%, so the same capacity limit as before, 50% indoor capacity, but it strongly encourages to reduce to 25% capacity, but it doesn't make that requirement. Strongly encouraging. And then indoor shopping, special events like holiday bazaars are exempt, but again, I'll go through one of the attachments that lays out a different specificity for capacity. And then university classrooms at 15. Next section in here is the hospitality industry, so restaurants, bars, breweries, and nightclubs and similar entities are closed except to allow outdoor dining, takeout, and delivery service. Entertainment facilities are closed. That's those described in this section 5 here. And then organized sports are closed to indoor competition. They're still allowed to conduct indoor trainings with some restrictions, and one of the attachments details some of those restrictions. Gyms, the 7 here, is set at 25% of capacity. Salons and personal care service is set at 25% capacity. And then retail and all other public-facing businesses are set at 25%. And so this includes the small retail to the largest big box. All are set at that same Sections 10 and 11 are, from my overview, pretty similar language to language we've seen in the past, requiring legible visitor logs, and then making sure that folks are communicating to employees and others of known COVID-19 exposures. Section 12 deals with hotels and other lodging, and the requirement to inform employees if they're lodging folks in quarantine or isolation. As you all know, the municipality currently has a variety, contracting with a variety of different hotels to beef up our quarantine and isolation, because we haven't had, and so that goes to that specific point. 12, and then the last one is remote work. So if you can work from home, then you should allow your employees to work from home, putting that requirement in there. Okay, so for all of the attachments, so that's the basic emergency order. Penalties, also this section, same as prior sections from my understanding. I think also there's one piece in here that, from my understanding, is a little bit different, and it just explicitly lays out that the individual businesses, nonprofits, and other entities who are in violation of the emergency order may result in a suspension of activities for up to 2 weeks. But otherwise, the penalty section remains the same, and that's it. So I've posted a link to this on my Facebook if folks want to go and read through that in a little bit more detail than what I've presented, just the overarching brushstrokes. I'm going to go through all of the attachments, and we're just going to go over capacity limits. At a glance, as I was reading these, a lot of the language seemed very similar to language in prior attachments. Some things like mask wearing, physical distancing, sanitization policies, and other safety protocols pretty much remain the same from prior attachments. Nothing big that's different. So I'm just going to go through capacity limits as I go through these. So first is day camps. That's attachment A. So the capacity limit here, it doesn't have a specific number. It just has the need to maintain 6 feet physical distancing, and that's going to be something that you're going to hear me repeat a lot. And in some of these, it doesn't have a specific number, but physical distancing sets a natural number depending on the space that you're operating. The next one here is attachment B, childcare facilities. So this one, the capacity is groups of no more than 20 children, and that is the only sort of static capacity that it has in here. And basically the idea is that there should be no mixing of groups of children, but otherwise the physical distancing is also another requirement. So there is no sort of big overarching number for childcare facilities otherwise. Next attachment deals with indoor shopping special events. So bazaars, fundraisers, arts and craft fairs. So this one has 2 different definitions for a capacity. This one has, so this one has a 25% of maximum occupancy for the space, and then it also has a 100 people capacity limit. So that's for indoor shopping special events. For hospitality, the indoor capacity obviously is non-existent because the folks in this industry cannot have indoor service, but there is an outdoor capacity there. Tables spaced 10 feet apart, no parties larger than 6 persons at one table. The exception is a single household with minor children, which is larger than 6 persons. But otherwise, there is no number put on outdoor capacity. It just depends on how much natural capacity that you might have to have outdoor seating. I honestly don't know how popular that is going to be given our reduction in temperatures recently. Organized sports. So the capacity, there is no number limit necessarily for indoor practice. It just needs to maintain the 10 feet physical distancing. Or if it's in a shared space like the dome, there's an additional requirement there. Physical distancing increases to 20 feet. And then for this one, as a reminder for the overarching emergency order, the competition needs to take place outdoors, so there is no indoor competition allowed, but the indoor practicing is allowed. Next is fitness and gyms. So the capacity here is 25% with the 10 feet of physical distancing requirement. Pretty simple on that one. And then the last one is personal care services. So tattoos, spas, hair salons. 25% capacity with 6 feet physical distance is the capacity requirements outline attachment. So all of these attachments and the emergency order itself you can find on the municipal website. And let me actually just pull it up so you all can see. 2 seconds. Right. So if you go to muni.org under the COVID-19 updates, if you go to emergency orders there, it'll take you to the top one is emergency order 16, and then the various attachments for the emergency order are right underneath it. So if anyone wants to take a look in greater detail, again, I did a reading of these, and from my reading, most of the details on any of the other protocols that are detailed in the attachments pretty much mirror the same language as prior attachments. So nothing from my basic understanding that's very different in these. Okay, 2 other quick updates before I get to questions, and I see that I have quite a few comments already, so I'll get to those in a second here, folks. So when Acting Mayor Quinn Davidson announced this emergency order, she also announced an effort with the Anchorage Assembly to allocate a $15 million package to help mitigate some of the impacts that we know will be caused by the modified hunker down. So I'm working with the administration to get the details out to the public, but the package is likely going to look like a mix of small business relief, hospitality and tourism relief, and rental and mortgage assistance. And looking and hoping to get that approved as soon as possible so that we can get these dollars out into the community. I think it's important to note, though, that there are current dollars that are still being put out into the community, current grant programs. I believe one of the grant programs still has something like $7 million in it that we are distributing as applications come in. So we're working to get more dollars because, I mean, we know that particularly this emergency order is going to have an. So we wanted to do our best to help mitigate as much of those as we can. Then last, Assembly leadership is working with the administration to continue advocating with our congressional delegation on for additional federal stimulus. Right now, Congress is the only one that can give local governments the resources that we need to help mitigate some of the impacts that we're seeing of different hunker downs that are being activated throughout the country and help de-stress our current public health workload. So with that, I think that pretty much covers everything that I wanted to talk about in a nutshell. So I'll go ahead and start going through the chat and do my best to answer these questions as they come up. If I'm not able to answer a specific question, I will do my best to take note of it and work with the administration to get an answer. Obviously, you know, I'm not the one that created these different mandates, nor am I an expert in all of them, but happy to get as much information as I can. All right, so first, I see that Grace Green has a question. You detailed it, but if you want to go ahead in the chat, but if you want to go ahead and read it, that'd be great.
Okay, hold on one second. Hey guys, so my question basically was about the hospital, and I know you guys, it might be a hospital policy thing, not necessarily like your call or anything, but I know you guys do collaborate with them. And so I was wondering because back in April when I had this little guy, we were closed down. There was like nobody there. They weren't doing elective surgery, anything like that. You know, and then obviously they are now. And I mean, I do know that the staff is stretched there, and everything like that. So I'm just wondering, why are they still, you know, doing those electives? Wouldn't it be wiser to not? I know you guys collaborate with them, so I don't know if that was on the table, but it seems like it would be a wise choice to do that. I was just wondering if you had any thoughts on that.
Sure. Yeah, so you're right that elective surgeries were canceled back during the first hunker down. And it is primarily a hospital policy on whether they want to continue the elective surgeries or not. And uh, from my understanding, you know, there are regular meetings between the administration and the hospital CEOs and some of their staff to talk about their operations and how they're doing, and you know, the discussions that the administration had, particularly with some of the staff working on the floor, is what led the administration to do a lot of this work. I think there was an article about that earlier today in the ADN. But this is a really good question, and I don't really know the answer to give a sort of a nuanced explanation, excuse me, of why hospitals are continuing to do elective surgeries. You know, I would imagine that hospitals probably would want to continue doing elective surgeries. There's probably some really good public health reasons why we want folks to continue doing these and not. But I will add that to my list of questions for why hospitals are doing that, and you know, as it relates to capacity, would canceling elective surgeries assist with hospital capacity? It's a good question.
Thank you.
Next, and I don't know if folks asked multiple questions, so I'm just going one by one as I see it in the chat. So, Dustin Sherman, you had something in the chat?
Yeah. Disregard the first part of that. I was being facetious. The second one, though, from what I understand, and I know a few tattoo artists, they're not affected by this. And I would think, and I have tattoos, I'm not against it. But if you're going to shut down other places like bowling centers that don't have blood everywhere, and skin exposure and all that kind of stuff, why are tattoo parlors not affected by this?
Yeah, good question. So, from my understanding, and I can ask this to the administration, but under attachment G, the personal care services, it does lay out spas, hair salons, barbers, tattoo. So I do believe that they do fall under the 25% capacity, like any other personal care service.
Yeah, I mean, I mean, it's like, it would be like going to a hospital and having a surgery. I don't know personally if you have tattoos or not, but you're breaking the skin and you're breaking the blood barrier. I have probably 25 tattoos across my body. I understand the process in that, but to cut it down to 25%, you're shutting my business down entirely, and we don't have any of that kind of stuff. We don't have any touching. We don't have any, you know, I'm a little offended by this, honestly, because the tattoo artist has to personally touch your body. They have to touch your sweat. They have to touch your skin while they're doing this. So to kind of pick and choose businesses that could be affected by this and not, you know, deal with that, it's absurd. I'm sorry. I mean, I don't see the point in cutting them down to 25%, and I don't want to see anyone lose their wages. I'm unemployed now, thanks to the order, but I don't want to see anyone lose it. But to pick and choose businesses like that and allow them to stay open, it just doesn't make any sense. It's completely ludicrous.
Yeah, no, that's a good point. And you know, I know conversations that I had and other assembly members had with the administration after the 4-week reset that happened in August. You know, we had talked to the administration a lot about, if you ever do one of these, and let's hope you never have to do another one of these, make sure that you are looking at any disparity between different types of employment. and making sure that you're addressing sort of the fairness and equity issue that we've heard a lot. So this is a good question. I don't know the administration's thinking on tattoo parlors, so I am happy to delve into this with the administration.
Well, I would here's okay. As someone that's recovered from COVID, my wife is recovered and is home now. She's doing well. As someone that has been tested and seen the people that are doing the testing, and also been in the hospital myself, and the type of gear that they're wearing in the hospitals, I mean, I wouldn't want to touch anyone's blood. I wouldn't want to expose myself or anything like that. So I think that if you're going to hammer any businesses, I think any kind of bloodborne business would be one that you would want to have.
I'm glad to hear that your wife is doing well, Dustin. And yeah, that's a good point. So I'll definitely raise it with the administration.
Thank you.
Christy, I see you're next in the chat that you had a question.
I just had a question of if there was any exemption, because I, like Dustin, have also recovered from COVID. And so, there's a lot of guidance out there that says you are good to go for 90 days. Is there any exemption to not limit those people that want to work and, get out of the house and be able to do things without being imposed by these emergency orders?
Yeah, that's a good question. Nothing that I read detailed any of those types of exemptions. For my part, I don't know how you would enforce those types of exemptions, but it's a good question to ask, especially as more and more is known about the virus. And then, hopefully when we start vaccinations, we're going to need to delve into these types of questions more. So, yeah, I don't really have a good answer for you right now, but happy to talk with the administration. All right. Next, I have Scott. You didn't have a question per se, but did you want to read your comment?
Actually, I do have a question regarding restaurants and hairstylists.
Sure.
So, I know there's been a big push that's being put on restaurants, and I'm confused with, I guess, the reason as to why, when you look at the limitations put on hairstylists, everything I've read anywhere said that it can't be proven about the spread of COVID at restaurants because of the limited contact with your server or people at other tables, where in hairstylists or hair salons or whatever, you're talking about one-on-one contact for an extended period of time. And I know that for one example, and I'm speaking from firsthand personal experience, that my mom went to a hairstylist. It was just her and the salon stylist in the salon. That was it. And the hairstylist they both wore a mask the entire time. My mom got COVID from the hairstylist, gave it to my dad. They're both 89 years old. They're both in the hospital. They've both been in the hospital for a while. But yet that hairstylist gave about 20 people COVID. So I don't understand how you can penalize one business that doesn't have the close proximity and yet allow another business that does have the close proximity and not penalize them. And when I say penalize, some of these restaurants don't have indoor seating except for just 3 or 4 tables, and they don't have a parking lot that they can put a tent outside. So I'm confused how restaurants can be heavily scrutinized, but yet hairstylists are not.
Thanks. Yeah.
And I'm being legitimate about this. because both
yeah.
my parents did get it from the hairstylist, and they're 89 years old.
Yeah. So first, I hope your parents are doing okay. So yeah, this is a good point, and I'm just looking at the chat. I think there are several others who have probably brought up this same point. So happy to address this. So from my understanding, and from the understanding that the Anchorage Health Department has, and the public health experts there, from the data that they are seeing, which Acting Mayor Quinn Davidson readily admitted that we are operating right now in somewhat of a data poor environment because we're being overloaded with cases. So our public health capacity to actually contact trace is severely limited. But from looking at the science that they have explored and just the data that they do have, the Anchorage Health Department, I don't want to say that they're necessarily pointing fingers, but they're looking at where the highest potential to get COVID is, and they have said sort of again and again that restaurants. Yeah, I see your hand, Dustin. That restaurants and bars are one of those places, and other locations where you're likely to be there seated for a longer amount of time, likely to not have your mask on. That those locations are where you're more likely to get COVID than, let's say, walking. Like I did earlier today, I spent maybe 20 minutes at a grocery store, and I was maintaining my physical distancing, had my mask on the whole time. So did everyone else in the store. Thanks to everyone for doing that. So that is what the public health experts are looking at. It's why that these emergency orders have targeted, because that's what people feel like, have targeted this specific industry because of the science that the Anchorage Health Department looked at and the data that I understand that there are different views on that, so I'm happy, and I think, Dustin, you're probably chomping at the bit to talk about that, so happy to hear from Dustin.
Well, real quick, Felix, and I'm going to give you a little bit of my experience on what we went through whenever we got diagnosed and when we had to deal with this. Okay, so we got tested. We tested positive. My wife obviously ended up in the hospital. I ended up at the ER at one point. Well, the testing facility, which was at the library, the LUSAC library, which is where we went and got tested, we got contacted by them once we tested positive. But I offered, and they did not care, and this is why you're losing your contact tracing. Okay, I offered, and they didn't care to even write down or document where we had been, who we'd been around. They didn't care. And honestly, I was a little bit shocked at that, because we knew exactly, we had taken precautions, and we knew exactly where we were at, where we had been, who we'd been around, and they didn't care. And now, obviously we got sick, and we got pretty sick, but the fact that they didn't even really want to document where we'd been or who had been around or what businesses we'd been in or anything like that. It's not the businesses that you're having problems with the contact tracing. It's the people that are actually getting the information, because I offered it and they didn't care. I literally mean that. They didn't care to even take it down. And I'm still in contact with them, and they check on us every day, but they don't care where we were at. So I don't know if that's something that you guys can try and fix, but the medical personnel that we dealt with, they didn't care where we were at. They didn't care who we were around. So if that doesn't tell you something, I don't know what does. Thanks for letting me run that through.
Yeah, that's really surprising to hear. And I don't know if they're operating under sort of the same MO of right now, sort of our public health infrastructure is so overwhelmed in terms of contact tracing that they're not going to add something onto a pile that they know we're never going to get caught up on. But you're right that they should at least be able to take that, right? That makes the most sense, is at least take the data.
Well, when we got sick, and this is what everybody should do, if you're going to get sick and you know where you've been, you need to contact the places that you've been to, inform them. And that's exactly what we did. Every place that we were at around the time that we tested and got sick, we contacted them to make sure that they understood that we had been in their place. And we wanted to make sure that nobody else, I don't want to see anyone get sick. I contacted a restaurant that we thought we had been at, and I found out a few days later, none of their people had ever tested positive or got sick, so I know that it wasn't there. But everybody that we had come in contact with, I informed them that we had tested positive. That's how you're going to fix this.
Great. Yeah, no, that's a really good point, Dustin, and thank you for doing that. I think that's absolutely everyone who gets COVID, they should take on that additional responsibility, and informing people is so important, because the more folks are knowledgeable, the better. Julie, I see that your hand is raised. Did you have something you wanted to add? If you're trying to speak, Julie, I can't hear you. But here, I can try to unmute you.
Okay, am I unmuted now?
There you go. Yeah, I can hear you now.
Thank you, sorry. So I did kind of want to add on, I know my question that I sent to you was about the singling out of the restaurants and bars, but when everybody is talking about this, I had to make sure that you didn't skip over me, because I am a licensed esthetician. And so when the beauty salons and the hair salons and the tattoo artists' names all came up personally, I don't think that we should be singling out any business, including the bars and restaurants. And yes, you have valid questions, but nobody really knows where anybody gets it from. I know hairdressers and estheticians, tattoo artists, we go through hours and hours and hours and hours on training on health and safety and blood pathogens and everything else that has to do with our business. So I don't know if anybody really knows where anybody gets it. I mean, is it from the person you passed in the hall? Is it from the door that you grabbed? And so again, you guys, we just need to be careful when we start calling out other businesses. I don't know why it seems like you are singling out the bars and restaurants, though, and the entertainment industries, because that really is what it seems like. And I really think where Dustin said how we can fix this, or what he thought the way was, I personally think the way that we can fix this is if we get everybody back to work, even if it is at 25%. And then also, you need to make sure that people have money coming in. Most of these people don't have another job. They don't have a backup plan. They work week to week. And now with the unemployment for someone who's self-employed being $133 a week, you keep saying that that's going to come from the federal government. What happened to the money that we've been getting this whole year? Where did it go? I know a lot of it went to special projects. What's happening is these people can't afford to stay home. If they have an opportunity to go to work, even if they've been in contact with someone, if they want to keep a roof over their head and food on the table, they're showing up for work anyway, and they're risking it. And that means they're risking all of us too. So I just am super passionate about being careful that we're calling out individual businesses. And I wish you could really answer what you've done with these special projects, you know, that you had the money set aside for, that really should be going into these people that are having to stay at home and not having an income. And maybe we could fix that problem if we could keep everybody working, or get it where they can afford to stay home.
Thanks, Julie. Good point. So actually, one of the things I wanted to bring up was advocacy on the state level. So the Assembly and the administration, we are actively working on advocating, of course, with our congressional delegation, but it's also important that we are advocating on the state level and talking with the governor about the funds that they have. From my understanding, they actually have a good, I don't know if it's a good chunk, but a chunk of unspent funds, which several of us are really pushing that the state reallocate that specifically to unemployment. If they could reallocate that to unemployment, that would help so many people. So that's something that we really hope that the governor takes leadership on, because there's not much time left for the state to expend those funds, and I think it would be unfortunate if the state had to return millions and millions of dollars to the federal government because they didn't take the leadership to actually reallocate those funds to where we know it's needed most. So that's something I think you'll probably hear about more, and I know that the governor is going to do the right thing and reallocate those.
Okay, well, what about you guys' responsibility also as the Anchorage Assembly? I know you keep passing the buck to everybody else, but you guys have a responsibility also. You're sitting on a lot of money also.
Yeah, thanks. So, Julie, I don't know if you had joined in earlier in the conversation, but I did talk about a package that the Assembly is going to be putting together, $15 million of additional stimulus, basically moving around some of the dollars that we had allocated. For example, one of the buckets was the reimbursement for FEMA. The state has committed to us that they are going to, as they normally do, pick up that tab. And so those $12 million that we had initially allocated to FEMA reimbursements, we're moving that over to helping out with rental mortgage assistance and small business and hospitality and tourism assistance. So yeah, that package is going to be coming forward ASAP, and we're still putting out dollars. There's still something like $7 million left in small business grants that haven't been put out the door yet. So as we're continuing to get applications, which I imagine we're going to get a lot more applications starting Tuesday, that we will hopefully be able to fulfill as many of those as possible.
Okay, can I make my very last comment and then I'll be quiet? So people want to go back to work. We want to work. We don't want to sit home and take a check. We want to go to work. And so maybe you guys could look at a way to make that, happen. So instead of closing down certain industries and not others, give everybody an opportunity to go to work. I know that it's terrible when one person dies, but we need to look at the figures and let everybody go back to work, go back to school, get on with our lives. This is not going away. We're going to have to live with it. Are we going to be this forever?
Yeah, thanks, Julie. Good points. And so, I mean, definitely a lot of folks are putting their hope on vaccines to sort of help us get over the hump that we are currently in right now. But you're right, we need to have a plan for us to get back to some type of normalcy, and that comment is appreciated and well taken.
Thank you.
Okay,
what about the money you allocated for the homeless housing? Is that still part of the upcoming budgets?
So so the dollars that we had allocated for the property purchases, I assume that's what you're talking about, Anthony.
Yeah.
Yes, those dollars are still allocated, and we are still looking to move forward with that.
So you could hold off on that project and give stimulus relief instead of blaming the state, correct?
So we are making a choice, Anthony, to continue moving forward with those projects, because that need still exists, and we know that the Sullivan is not a permanent fix to the issue.
So making more homeless people is going to fix the problem?
So Dustin, hold on, folks. So Dustin has had his hand raised for a little bit now. I want to go to Dustin before we continue. I have a lot of questions that I still want to get.
Yeah.
So Felix, and this is kind of on Anthony's question. So, and I know that the homeless stuff is still on your agenda and everything else, but I'm looking at this thinking you're going to make more homeless by keeping us out of work, and you're going to exacerbate the problem with the homeless population as it is. I know that you guys had talked about, I seen Mr. Weddleton had posted that the Alaska Club was not going to be an option. They're not going to, they're changing that. So where's the money from that going to go? I guess that would be my question on that. And Scott Stansberry's been waiting for a while too, just to let you know.
Yeah, thanks, Dustin. And I should have used last names. I was actually referring to Darden, who
Oh, sorry.
had his hand raised for a while. But yeah, good question. So right now, the administration is they did their due diligence, like they let everyone know that they would, and they are looking at other alternatives. And I support the administration's efforts to look at other alternatives. I mean, if in the end, the dollars, nothing works, nothing pans out, then we're not just gonna keep that money in the bank. We'll reshuffle those dollars to grant program or some other program that we'll be able to get at.
Yeah, but you have people right here asking you for money now. Really.
Yeah, I see that, Anthony, and I hear it, and that's why we're putting forward the $15 million program, and we are going to be asking our federal delegation for more help. Okay, so Darden, did you want to go ahead and unmute yourself and speak?
Mute. Hey, can you hear me on this microphone?
I can hear you, yeah.
This is the most cowardly display I've ever heard of in my entire life. People are meant to meet in person. We've got this thing called the Constitution of the United States. And in this Constitution, we have an amendment. And it says very clearly that Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof, or abridging the freedom of speech. What do you think you're doing with these masks and people from going out, or the press, or the right of the people to peaceably assemble? So here's the deal. And to petition the government for redress and grievances. You are violating every single one of these simple constitutional liberties. Therefore, Felix and all of you other Chi-Com New World Order operatives, all of the things that are coming out of your mouth and all your fake writings are null and void because they are unconstitutional, holding no grounds. And we wrote a special amendment, a well-regulated militia being necessary for the security of the free state. That is what we are, the citizens of the United States of America. We are not Chinese communists. We are not Satanists. We're not going to bow down to the New World Order, which you are working lockstep with. They are on record saying they never want it to go back to normal. Thanks, America is standing in the gap. And as America goes, the world goes, and we're not falling for this phony, fake narratives.
So I'm gonna keep us moving on, but I hear you, Dustin. So I'm gonna do Scott, Rosa, and then I'm going to keep moving on with the questions. So go ahead, Scott.
Felix, first off, I believe through disagreement, through civil disagreement, people learn from each other and exchange ideas where we can learn and grow to make better, wiser decisions. I understand why y'all are doing some of the stuff that you're doing, such as masks. I disagree with masks, and 35 years, that was my specialty, was respiratory protection. Now, I understand y'all are getting advice from the medical field. The medical field takes their marching orders from OSHA. Doctors do not prescribe what to do. OSHA prescribes to the doctors what they shall and must do. Now, what the hospitals are doing and the EMS is doing, they wear full head air supplied respirators from a air purified source so that they can't get the contamination or the virus in them. I would like to entertain over a cup of coffee to have a discussion with you, and I can give you my background and all the OSHA regs that says that everything about masks, the way they're being used, is wrong, and how businesses, not the city, federal, state, and city are exempt from OSHA. It's just the way it is. You're not required to follow the OSHA standards or guidelines. But any business we have to follow the OSHA guidelines, and we're in direct violation of those guidelines. Now, I realize this is kind of off topic, but I would love to have a civil discussion with you, and I can give you some information and documentation to support everything that I say. And I was a consultant in this field for 35 years. So I have a little bit of experience and science data backing up what I'm saying. It's not just me, some uneducated person, but I would actually enjoy a conversation with you, a civil one, over a cup of coffee, if you would so be willing to entertain that. Because I think, one, it would offer you an understanding of how a lot of people are coming from, and it might understand why doctors should not be telling the public what to do. And doctors are good, they're great, they're educated, but they're all about healing people once something has got into the body. That's their specialty. It's not about the prevention of getting it in, it's how to control it once it's in your body. Where OSHA scientists are about the prevention of it getting in. So if you would be willing, I would enjoy that greatly, sir.
Great. Yeah, thanks for that invitation, Scott. I always appreciate conversations with folks who might have different knowledge, different points of view on subjects. So yes, happy to set up a time for us to virtually have coffee, because I think at this time that's probably the smartest route for us to take. So I think you probably have my email, Scott. If you don't, I'll make sure that gets to you and to everyone. I'll just put it in the chat. It's not a state secret or anything. And feel free to reach out to me, and happy to set up a time for us to have a conversation.
Thank you, sir.
Thank you. Okay, so last person for verbal comments, Rosa. So if you want to unmute yourself, then I'm just going to go through as many of these other comments and questions as I can with the time we have left. So you're unmuted, Rosa. I can't hear you.
Okay, can you guys hear me now?
Yeah, now I can hear you. Yep.
Okay, so it is extremely frustrating to see that there is definitely preference in one industry over another. And for me, just like Julie mentioned, it's not about discriminating against one industry or pitting ourselves between one industry and another. For me, we should all be opened up, and it's not just me, Felix. You know, you probably think we're individual people that get on here and just are talking for ourselves, aren't talking on behalf of other people. But honestly, there are some people in our community that just, you know, can't speak up because they're nervous, they're shy, whatever it is. They're at work, they're working right now, those that are, or just having a really hard time with this. So what
Oh, Rosa, I lost you. Rosa? Let me try something here.
If you get a phone call or something like that, it'll cut your mic off.
Okay, Rosa, I think you're back now.
Hello?
Yeah, there you go. You're back now. Go ahead.
Sorry, Zoom is not my best app. So what I'm getting at is when you hear those of us that are testifying at these assemblies, testifying at these meetings, it really isn't just about us. We are talking on behalf of our community, the thousands and thousands of other business owners, community members that, you know, can't get on these calls right now. But what I want to point out is something Dustin Sherman said about, if you don't open up these businesses, or at least let all businesses open at a 25% capacity or half capacity, you're going to have a bigger homeless problem, okay? We are not lazy people. We are hardworking Americans. I'm not used to, and a lot of people I know are not used to sitting at home collecting a check, not trying to disrespect anybody for whatever lifestyle they choose, but we're not those people, okay? We're hardworking. We like to make our own way. I don't want to sit at home and the government give us out money, because then you're going to control what I'm going to do with my life, okay? I'm going to make my own money and make my own choices, control my own life. I'm a grown adult, and I don't need some other person coming over here trying to adult for me, telling me what I need to do. And I'm sure other people feel that exact same way. They don't want you to tell them how they need to adult. They know how they need to adult. And you as the government are there to facilitate the needs of the people, okay? The will of the people. It's not what you think is best. It's not what the assembly think is best. What do the people want? Okay, we the people want to get back to work. We the people want to pay our own bills. We the people want all businesses to open. And I understand that there are some people that are living in fear, but to put things in perspective, I don't see the nation or any state locking down for flu. More people, per the CDC website, have died from the flu than they have from COVID in Alaska alone. Second, over 500 people have died of heart disease in Alaska, and the COVID numbers don't even come close to that, okay? So why is it that we get to pick and choose what is a health emergency? I don't see McDonald's and all of these fast food places getting shut down because of the heart disease. We still let people keep buying this stuff, and then the people that get EBT and SNAP and all of that, they get to fill up their carts with all of these heavily processed, artificially sugared stuff, and nobody stops their payment for that, right? They still get to make lifestyle choices with that money the government gives them, okay? So that being said, on the other hand, us responsible adults that have mortgages to pay, that have vehicles to pay for, that have children to raise, children to put in school, in private schools now, because the school system is also closed based on your guidelines, you are causing more affliction on your community, on your constituents, per these mandates, than the actual virus it is itself, okay? We have a 99.97% chance of surviving, 99.997% chance of surviving this if you are under the age of 69 and you don't have any underlying conditions, okay? So we are going to survive this. It doesn't matter how many more shutdowns you do. It's not going to mean that this is going to go away. It doesn't make COVID go away. It's not going to, none of that. All it's going to do is make it worse, because what do we do when flu season comes around? You stay home. If you're sick, stay home. You don't have to go out. Don't expose others. Most of us have that common sense, okay? So now that you are putting all of these heavily regulations, people are going to work despite being sick, getting others sick, because now their hours are being cut. So if they miss that one day they're scheduled for work, they have no money coming in, and the government isn't giving them any money. Not like that's the government's responsibility, but it also isn't the government's responsibility to tell people to stay home and how to live their life. That's sure. Where your guys' responsibility ends in regards to having law and order in the city, but not telling people how to live their lives. You just can't do that.
Thanks, Rosa. I hear you, and I
no, but I'm not done. So the thing is,
so Rosa,
so the thing is that I'm not
done. I need
done.
to keep moving on, Rosa. I really appreciate
and I get that.
You sharing your comments.
And we are all here and want to be heard as well. And we have to hear you guys at every assembly meeting babble on for 45 minutes.
Thanks, Rosa. I have to keep moving on.
Well, so how many people is it going to take?
So one of my questions is, what are the repercussions if businesses don't stay closed? What are the legal?
All right, so I'm gonna keep moving on because there's a whole bunch of other questions that I have. So I'm gonna spend the rest of the time that I have, which isn't much, going through some of these questions. So let me just try. Yeah, so folks are asking about specifics in terms of numbers from each industry and contact tracing. And so I actually asked the administration not that long ago, where are they getting, what are the most recent hotspots? And the administration and the Anchorage Health Department, they haven't been able to identify hotspots since I think September is what they told me, because they have been so overwhelmed with contact tracing, and that's traditionally how it is done, is through the contact tracing and through what the tracers are able to surmise. They can tell, okay, here's a hotspot because we did the work and we know that this spot had 15 positives, and but they haven't been able to, again, since September.
But they don't want to take info.
Be able to identify any hotspots, which are posted on the municipal website. That is a deficiency that the Anchorage Health Department has let people know. So, Sarah, that was part of your question. So, did you have a quick comment on that?
Yes. And my comment, I'm sitting in a parking lot watching you and listening to everybody, and I'm looking across the street at Fred Meyer's parking lot that is, has a bunch of people at it. I drove past Target on South Side on Friday, on Black Friday, and their parking lot was at capacity pretty much. Nobody was standing outside waiting to get inside. Everyone wanted to go in, and they wore their masks, okay, and they went and got their sale items, okay. You don't contact trace at grocery stores. You guys don't fill out a little slip at the grocery store to see if, to give your name and your number and everything, right? Nobody does that at grocery stores. So you can go into Fred Meyer and you can go into Target, you can buy your PlayStation, you can buy your bedding, and you can buy your lampshades, okay? No problem. But you can't go and have dinner at a restaurant. You guys are picking and choosing what businesses are failing and what aren't. Fred Meyer could easily be shut down for 2-3 months. Target, same thing, and they would be fine. You're shutting down these restaurants, and there's real people that have children that they need to feed their kids, and you guys are shutting them down because it's a hotspot or it's where contact tracing. Okay, well, yeah, you're contact tracing at a restaurant, you're not contact tracing at Fred Meyer or Target. And to tell me that everybody's social distancing, bull crap. They're not social distancing, okay? And even if they are wearing masks, you're putting all this energy and saying masks are the saving grace. The $1.99 fabric you got at Joann Fabrics is what's saving all these people. No, there's no possible way. You guys, if you really want to start having a little bit of faith from us, okay, you would shut down every other department within Fred Meyer other than groceries, okay? So you can't go get curtains and lampshades and PlayStations and DVDs. You can only go and get groceries, okay? You know what else I would appreciate is you guys giving up your paychecks. I haven't lost $1. I've been able to work from home, but my heart is just broken for these people that are being pulled around, yanked around, and not being able to work because you say they can't work. It's bull crap. And I'm not cussing because I normally do, and I'm trying really hard not to, but it's crap. We're not all in this together. There's no way we are. When you get a normal paycheck, and the mayor gets a normal paycheck, and Fred Meyer employee gets a normal paycheck, but somebody that works at Bear Paw can't, and you have these people that are trying to allow for their employees to work still, and they're stressing out and they're losing sleep at night because they know that Cynthia has 4 kids she has to feed, and you're saying nope, you can't work. It's not fair. It's not fair that somebody can go into Fred Meyer and spend 4 hours in there shopping for curtains and new bedding, but you're telling somebody that they can't open up their restaurant. That's not fair. That is not fair, and that's all I have to add to that.
Thank you. All right, so we are out of time, and I didn't get to quite a few comments. So I am gonna save all of these comments that were received today, and I'm gonna do my best to work with the administration to get answers and responses to all of these different comments received. I really thank everyone for attending today and for sharing your thoughts with me and for all of the questions. So thanks again, and I hope everyone has a good evening.
That's it?
That is it, yes. Thank you, Anthony.
Yeah. What up? Jesus. I was unmuted to the left. So, does everybody here feel like their voice is actually getting heard?
No.
Not a word.
All right, so we're not all
No.
just full of it.
Personally, I think they cut us off because they didn't have a whole bunch of their followers on here helping them out. Honestly, I think that's exactly what it is.
No backup.
Yeah, they have no backup. I mean, and when you catch these people out on the streets, you got to ask them the same questions and you got to push them, because we're never going to get any answers. We're never going to get anything until, unfortunately, until they understand that not everybody's against every single thing that they want to do.
There's the numbers during their, BLM rally improved. I have a little graph there just to show them, like, so your little political event is okay. Now all of a sudden we have a huge spike. Like, that's not a weird coincidence. Meg Zeleda, Forrest Dunbar, you're all there.
Well, did you see what they did with the Valley? So the wow. I'll finish my thought. So if anyone's on here watching, so the Valley wasn't supposedly reporting some of their COVID cases, and now there's going to be a huge spike because the Valley had like 1,600 cases held back or something like that. So expect a huge number to increase in Alaska just because of that. And they're putting this on the Valley. They're not owning up to the state numbers or anything like that. They're pushing it on the Valley, basically saying it was their fault. So anyway, I will catch you all later. That was the wow. Instead of continuing to listen to us and take the time on a Sunday evening when I'm sure that there's nothing else going on, they decided to cut us all off. So that's the Anchorage Assembly and Felix Rivera, the chair. We are in sad times, people. We are in sad, sad times. All right.